Hello Year 9 and welcome to this week's home learning. Today's lesson we are looking at the impacts of uneven development on health. Our learning objectives today first of all are to understand the differences between HIC and LIC diseases. So which diseases would you find in HICs and which diseases would you find in LICs. We're then going to move on to examine malaria as our case study for an impact of uneven development. So we're going to look at malaria and look at what its impacts are in certain countries, and then finally we're going to assess the extent to which malaria is a future global threat. So what's the threat of malaria across the globe in the future. So we then, in the bottom left hand corner, you've got your equipment that you need today, so you just need to read through that so you know what you need for today, and then you've got your know your level on the opposite side, and that tells you which task you should be completing when you're completing the tasks you are asked to do. Okay, so learning objective 1 for this lesson is to look at HIC and LIC diseases. So countries will have different diseases based upon their wealth and the uneven distribution of wealth. So all this means is that the amount of money that they have within a country will tell us what types of diseases they will be more susceptible to or more likely to have within those countries. So what we're going to do as our first task is, I want you first of all to create the mind map that's in front of you, and you can see that you've got a mind map that says uneven disease, and then you've got two branches, HIC and LIC. Remember, a HIC is a high income country, and these places have high levels of development, so you'd expect them to have healthcare, good healthcare, high levels of education. Generally speaking, these people will make more money while working, which means that they will be richer countries. Whereas your LIC countries or your low income countries, these are countries that have low levels of healthcare. They may not have access to the medication they need to prevent diseases. They've got lower levels of education, so they don't know about they haven't been taught about ways to protect themselves against diseases, and they will also make less money. So again, they'll have less money within the country, which makes them a lot poorer. So what I want you to do is, once you've created this mind map, I want you to go over to class charts, and I want you to watch two YouTube videos which talk about the diseases you would find in HIC and LIC countries, and I want you to add information to each branch of your mind map. So just pause the video now, create your mind map, and then go over to YouTube and watch the two videos about the diseases in HIC countries and LIC countries. So now you've completed the first part of this task, we're going to move on to the second part of the task. And as you can see, I've put 7 different types of diseases that can be found across the globe. So for developing, I want you to add these 7 different diseases to the correct part of your mind map. So for example, you're going to look at measles and you're going to tell me whether you think it's a HIC disease or you think it's an LIC disease. And you're going to do that for each different disease, link it to either HIC or LIC. For secured, I want you to then explain these diseases and why they are found in these types of countries. So again, if we use measles as an example, why are measles found in either HIC or LIC countries? So measles are found in HIC countries because, or measles is found in LIC countries because, and then you just explain why you'd find them in that country. For mastered, then, I want you to explain the key differences between the two branches and how does this link to their development. So once you've linked all the diseases to the different countries, to the HIC or LIC countries, I then want you to say HIC has these diseases because this links to their development because. Okay, and again, LIC countries have these types of diseases because, and this links to their development because. Okay, so just want you to pause the video now and complete the tasks that I've just explained for you. Moving on to learning objective 2 of this lesson then, we're going to look at malaria as our case study of a disease that is found in LICs and how that causes uneven development. So what we're going to do then, your task then, you're going to be given a series of clues about the disease of malaria. You need to complete the appropriate amount of questions about the disease to create your own miniature fact file. So as you can see, you've got a series of questions that you need to answer while watching the videos. So what you can do is you can load up the video from class charts of actually given these questions on a Word document that you can actually complete on while you watch the video. So if you're doing developing, you will complete the developing questions, and there's 4 of them. Secured, you'll do the developing questions and the secured question. And if you're doing mastered, you'll do the developing, secured and mastered questions. So pause the video now, go over to class charts. You can open your Word document so that you can answer the questions using that, or you can do it on a piece of paper, and then you need to watch the video to answer these questions. Our final learning objective to this lesson is to assess the global threat of malaria to the rest of the world. What we're going to do first of all is we're going to look at the compound bar chart that you can see on this slide. And this compound bar chart is showing you the global malaria deaths by the world regions, so the different regions around the world. And you can see that each region of the world has a different colour related to it. You've then got the dates of the year across the bottom, and we're looking between 2000 and 2015. And then on the y-axis, okay, you've got the amount of deaths. So to read this graph, I'm just going to give you an example of how you would read it. So in 2000, if we look at 2009, the total amount of deaths caused by malaria was around about 850,000. And we can see that because the highest point on the graph is just above 800,000, and I'm gonna estimate that it's about 850,000. Of those 850,000 deaths, 750,000 of those deaths were in the region of Africa, or in the continent of Africa. And we can see that because Africa, that section of Africa, it finishes at 750 on that graph. You've then got the other regions, and again these are rough estimates because again there's not exact numbers. So if we look at Southeast Asia, which is the next biggest part of that graph, that's got about 50,000 deaths from malaria in 2000, and that's how we read that graph. So you'd look at each year, and then you would split up the different colours to tell you how much or how many deaths there were in terms of malaria reading this graph. So what I want you to do is to take about 90 seconds to look through this graph and think about the questions that are on the board. So I'm going to let you read the questions that are on the slide here, and I want you to have a go at answering those questions. So pause the video now and have a go at answering the following questions that are on the slide. So now that you've had a chance to read the graph and have a go at answering those questions on the board, let's go through them together. So the first one says, where in the world has seen the highest amount of malaria deaths? Now, if you look at the compound bar line graph, you can see that most of the deaths that have been caused by malaria are in the continent or the region of Africa. And we can see, as an example, we can back that with an example. In 2000, there were 750,000 deaths linked to malaria. And that number generally is the highest. Africa's amount of deaths is always the highest. And we can see that because it's kind of taken up the biggest part of this compound line graph. Okay, we then move on to look at why have other regions seen less? And this is where you need to use a bit of your previous knowledge. So why have the other regions not have as many deaths? So if we were to talk about, say, Europe, which you can barely see on this compound line graph, okay, part of the reason for that is that they have a cooler climate. So the fact that mosquitoes can't survive in that climate, so they can't carry the disease and pass it on to other people. Another reason would be that they've got a higher level of development. So they've got better healthcare, they've got better education, so they know how to look after themselves, access to clean water. Yep, all these reasons why that link to levels of higher levels of development that also show that they would have a lower death rate from malaria. Next one then was why might the number of malaria deaths be dropping? So why can we see that generally in this graph, this compound line graph, the amount of deaths are dropping? So why do we think it's declining? Generally, that's because across the world now, there is better basic healthcare, and it's improved across the globe. So even within the continent of Africa, they're beginning to get more access to the medicines, the medication that they need to prevent malaria from spreading. And then finally, what 2 scenarios could change this graph in the future? Okay, Why might this start to increase again? So there's two reasons that could happen. One would be climate change. So imagine if the climate's going to get hotter, that means our mosquitoes can transmit the disease in other regions that they weren't before. That means that the death rate would increase. And another reason would be limiting the development of Africa. So if we start to hold as a globe, start to hold Africa's development back, and they stop developing, because at the moment Africa is one of the fastest developing continents in the world. So if that development starts to slow down or starts to decrease, again, that will then increase the amount of deaths from malaria. Okay. So what we're going to do then is we're going to use that information that we've just learnt about from that compound line graph to look at the global threat of malaria. So what I want you to do is you need to make a decision about whether or not malaria is a global threat. And what I want you to do now is, can you just quickly create this table either on your Word document or on a piece of paper. So just pause the video now while you create this table. Okay, now that you've created this table, the task that I would like you to do then, I want you to add evidence from today's lesson and also link to your prior knowledge, that's from information that you've learned about in previous lessons, to each column to support the statement at the top of the table. Remember, the table is, yes, malaria is a global threat. So that means that it's a threat to everyone around the world. That's where you'd put yes in. And then no, malaria is not a global threat. And why is malaria not a threat to everywhere in the world? Okay, so you need to, for developing, can you add 2 pieces of data or information to each part of the table? So 2 pieces for why it would be a threat to the globe, and then 2 pieces of information why it's not a threat to the rest of the world. For secured, explain how this does or does not make it a threat to the world. So once you've put your piece of information down, this is a threat to the rest of the world because, or this is not a threat to the rest of the world because. And then for mastered, mastered students will make prior links to learning that you've learned before. So you need to link it to things like how climate influences the global threat of malaria. What about the GNI in the country? So remember, what about the gross national income? How does that influence the global threat of malaria to the rest of the world? On the side, you've got some things to think about. So things you could link it to climate. Okay, what's the weather like in those areas? Wealth, how much money do they have in different regions across the world? Resources, so that could link to healthcare, it could link to clean water, could link to food. And then finally, healthcare. Again, how can you link this global threat to any of those 4 different ideas, just to help you complete this last task? So make sure you've created this table. Once you've done that, you can pause the video and have a go at completing the tasks that I've just explained. So that brings us to the end of today's lesson. Just before we finish, I just want you to go through what I'd expect you to upload to class chart. So the first thing I want you to upload is your mind map of the HIC and LIC diseases that are found in those 2 different areas. And again, that links to our first learning objective, which was understanding the differences between HIC and LIC diseases. And then second, I would like you to upload your table of the global threat of malaria. So that is, do you think malaria is a threat to the world, or malaria is not a threat to the world? And again, that links to our final learning objective, which is assess to the extent to which malaria is a future global threat. Once you've uploaded that work, then you have completed this lesson. So well done for taking part today. Geography team is really looking forward to seeing your work. Thank you for completing the work today, and we will see you soon. Thank you.